lot of our research is aimed at treating cancer on an individual basis and treating patients individually for their own specific cancer. In that way, our research will enable us to really make cancer a chronic disease in the future. So a lot of the previous research we've done, funded by Cancer Focus Northern Ireland, was centred around understanding why women who are at high risk of getting breast and ovarian cancers because of inherited mutations in genes such as the BRCA1 gene develop specifically breast and ovarian cancers. Because we know that these genes are involved in fixing damaged DNA in all of our cells in our body, and yet women with these inherited mutations tend to get breast cancers. And that research really fundamentally understood that estrogen and high levels of estrogen, particularly in breast tissues, are driving breast cancers in these women. And that allowed us to really think about how we might use that information to prevent breast cancers in women with a BRCA1 mutation. And it just so happens that there are drugs already available to suppress estrogen levels, and we've now used those drugs in a new trial which is open in Belfast to try and look at the ability to prevent breast cancer development in women at high risk of breast cancer and really offer those drugs as an alternative to risk-reducing surgery in those women. So a significant number of women develop breast cancer due to an inherited mutation which is passed on through families and really increases their risk of breast cancer. In fact, some of these women have a between 60 and 90% chance of getting a breast cancer and up to even a 60% chance of getting an ovarian cancer in their lifetime. And for that reason, we often offer these women risk-reducing surgeries. Women such as Angelina Jolie, which has been very well publicised, carried a mutation in a gene called BRCA1 and opted to have a risk-reducing mastectomy and an oophorectomy, which is removal of the ovaries, to prevent herself from getting breast and ovarian cancer. And our research was really aimed at understanding why women get specific breast cancers, and we focused on estrogen and estrogen levels that drive breast cancers in these women. And from that research, we were able to propose a clinical trial using currently available drugs to suppress estrogen in these women and potentially prevent them from getting a breast cancer using these reversible drugs rather than undergoing risk-reducing surgery. So really offering these women more options in terms of their risk reduction. So currently, women with a high risk of getting breast and ovarian cancer are offered risk-reducing surgery, and that's removal of their breasts or ovaries to stop them from getting a breast and ovarian cancer. And we really hope that in the future, we may be able to prevent the development of breast and ovarian cancer in these women using drugs that are already available. And if we can do that, these women will have extra options in terms of their risk reduction, and also some of these options are reversible. So for example, a woman may be able to have these risk-reducing drugs for a period of time, go off these drugs, perhaps have a family, go back on these drugs, or alternatively decide to have surgery at a later date after having a family. So our new research is focusing on women who developed a second breast cancer 6 months or more after being diagnosed and treated for their first breast cancer in the opposite breast. And really what we want to understand about these women is what are the risk factors for getting a second breast cancer and how many of those second breast cancers may have been related to their first breast cancer. And the reason for looking at all of this is in terms of we're focusing on personalising the treatment for these women. So realistically, if a woman has developed a second breast cancer that's related to their first breast cancer, that will impact how we decide to treat that woman. And additionally, and more importantly perhaps, if we can identify those women at an increased risk of getting a second breast cancer, we can offer them a double mastectomy at the time of their first breast cancer. And perhaps equally or more importantly, for those women who aren't at risk of getting a second breast cancer, we can advise them they don't need to have a double mastectomy, which is an operation which is being increasingly used for the treatment of one-sided breast cancer, despite the fact that it doubles the complications from the treatment. By raising money for Cancer Focus Northern Ireland, you're supporting world-class research here at Queen's University, which will benefit breast cancer patients and other cancer patients all over the world, but particularly benefit those here locally in Northern Ireland.